Can I call you Dr. Mark?
Please.
It's okay?
Or
Okay.
maybe Dr. Min.
I don't care what they call me as long as they call me. You could choose and alternate minute by minute.
So it's an honor to have you here, Dr. Manny.
Likewise.
Yeah,
Honor
thank you.
to be here. My name is Mark Monty. I'm a plastic surgeon. I practice in Los Angeles, specifically Beverly Hills, California.
Very nice.
It's sort of a hornet's nest of plastic surgeons where in the few square blocks where I practice, there's dozens of plastic surgeons, even in the couple buildings where I am. And I'm sure Brazil has similar concentrations of plastic surgeons. So we have that in common. I grew up in Texas, in the United States, grew up in West Texas. I went to Harvard undergraduate and did my pre-med work there, and then did my medical school and plastic surgery training at Baylor in Houston at Baylor College of Medicine.
Yeah.
So now I practice in Beverly Hills. I primarily perform facial rejuvenation procedures, facelifts, stem cell injections. I call it mist, nano fat for the skin, and just anything to make people look younger and better. That's my goal.
And how do you think about the fillers, the Botox injections? Do you think these procedures is helping you in do your practice?
Well, to be frank, fillers do help
Because
fillers,
it's too common nowadays.
It's very common. It's no secret that I'm a little bit anti-filler. I think fillers are kind of overdone.
Yeah.
It helps me in the sense that people kind of get what we call filler fatigue, where they're kind of tired of fillers. And the fillers stretch out the skin quite a bit.
Yeah.
And, fillers have definitely given people a gateway into the aesthetic arena, which is good. On the other hand, I think they go to an extreme where they're told that the fillers, number one, they're told that the fillers will lift their face, which is not necessarily true, because fillers have a higher specific gravity than native tissue. And so eventually it's going to droop, especially as the patients get older.
It's the same in the boobs. When you
Exactly.
put a big implant,
Yes.
you put more weight and
Yes, I use that analogy all the time, and the implant and the silicone in the implant is like the filler, and it squeezes your native tissue out, makes it thinner.
and there are many corrections you have to do with this case. Overfilled face.
Yes.
Yeah.
Yeah.
It's hard to treat.
Yeah, it's hard, and I think that's one thing I've sort of tried to be on the vanguard of is dissolving filler, because filler not only distorts the face, but it also, when I do a facelift on someone, for example, I want to see what their aesthetic baseline is. I want to see what they look like, and I also, I want to see the before and after picture. I have the before picture hanging in the operating room. So I don't want to see a face full of filler and then try to lift that. It's going to look even more unnatural. So I have an ultrasound. I call it the filler killer. There's a video on my Instagram with the theme from the movie Jaws. You guys have heard of the movie Jaws. It's a shark attack movie from the 70s. So maybe you have. It's before this generation, but it's a movie about it. It's a suspenseful theme song that I play while I'm doing the filler killer, which is where I have an ultrasound, and you can actually watch the needle go into the little pocket of filler, and I can dissolve it pretty efficiently. So I like to dissolve filler. Filler done well does look great, but I prefer fat. I prefer natural.
Do you dissolve
tissue.
the filler and schedule the surgery to time after?
That's a very good question. It depends. I prefer to start dissolving it as soon as I can, but then a lot of patients are afraid of what they're going to look like without the filler.
Yeah.
So with those patients, I try to time it where, it's within the 2 weeks of the surgery, because it takes multiple sessions.
All right.
As you may know, I mean, especially if you're dissolving it without an ultrasound, but even with the ultrasound, it takes 2 or 3 times before I can get out all that filler.
And we look nowadays. The people looks all the people that have an overfilled face, the same face.
Yes.
You saw the people. You are the same of your other.
They look a little bit like maybe Kim Kardashian.
Yeah.
It was beautiful, but not everyone should look like her.
Yeah. Yes.
Right.
Yeah, my wife, she's a dermatologist, and she loves fillers, but she has this great concern about over-injected and oversized and everything like that. And she created a term that in English is like respectful beautification.
I like that.
And I helped her to create this.
If it's not trademarked, I'll borrow it. Or I'll give her credit.
In Eng-
I'll give her
you
credit,
should
whatever.
because in English is not in Brazil.
Okay.
We have the
You have
it's
a
a brand.
trademark.
It's,
Oh, good for
we
you.
have it in
Okay.
Brazil. Yeah,
Good for her.
yeah. But and
There's
I
a
took
lot
it.
of yeah.
I took it from English. From English, I thought in English like
Yeah.
respectful beautification, and then I translated to Portuguese.
So what is it in Portuguese?
Portuguese is embelezamento
Yeah.
respeitoso.
Respeitoso. Okay.
Yeah,
Got it.
So because she's very concerned about this
Overfeeling.
oversized. You see, so
Yeah.
I think it's important that when we have to show what we are, what we really are for the patient. So
Right.
a patient that wants an oversized face is not going to look for Dr. Manny because they know what we like.
They know that I don't like it, and people seek me out for that. And you know what I always say is that I this long drawn out analogy, but I woke up at 3 a.m. with a certain analogy, and so bear with me. Okay, so we eat with silverware, but that doesn't mean that silverware is the cause of our eating. We eat because we're animals, because we're hungry.
Mm-hmm.
We do plastic surgery, so silverware is a cultural thing that makes us that we use to eat. Plastic surgery also is a cultural thing, but the root of our having plastic surgery is not cultural. It's in our animal instinct to deceive. So it's kind of a long, drawn-out argument, but it's important because, like a chameleon changes its colors to match its environment and to get away from predators. We have a rhinoplasty to look younger and enhance our success at mating. Or women will have breast implants so their breasts look more, fertile, and so these things are a reflection of our animal instinct to be deceptive. So if anything is noticeable, like filler, like exaggerated filler, then you don't look better or younger. You look like a bad liar.
Yeah.
That's what I always tell my patients, and they get it usually after a while. You want it to be invisible.
In which moment of your career do you go to the facial surgeries?
That's a very good question, and I started out.
They started you do any of the surgery?
Yeah, so I went to medical school specifically wanting to be a surgeon. I knew I had the hand,
Just
the
surgeon.
dexterity, just a surgeon and a cardiac surgeon as well.
Cardiac surgeon.
Same as me.
You
Yeah,
too,
Exactly
yes.
the same.
Yeah.
Yeah.
Cardiac.
Yeah.
I didn't
Well-
want to be a doctor. I want to be a cardiac
car-
surgeon. You
No
know?
doctor.
Same thing. It's like kind of a thing where it has an edge to it. It's kind of ballsy.
Yeah.
But you're saving
Yeah.
lives.
Yeah.
But I probably like you. I kiss the ground every morning that I did not become a cardiac surgeon
Yeah.
because it's
When
such it's a miserable
when you
life.
saw the routine of a
Yeah.
cardiac routine.
Yeah, and a lot of what they used to do is done by cardiologists now, so they've kind of taken away. It would be as if no more facelifts and everything was done with filler. That would be a nightmare for us. But thank God that has not happened. It will not happen. But I went to medical school specifically wanting to be a cardiac surgeon, and then I always thought cosmetic surgery was a bit superficial, so I didn't want to do that. Went through that whole thing. But then when I first saw my first free fibula transfer, and I realized that plastic surgery is a lot more intricate. We know the body from head to toe. We know anatomy from head to toe, and there's no other specialty that fits that description. And it's just a beautiful thing to be able to have that knowledge and to be able to help people with it in whatever way you do. But to answer your question more succinctly, facial surgery, the first facelift I saw, I said, that's what I want to do. The first one I did on my own as a resident, the patient, took off her bandages and she was so happy she started crying. So I figured anything I can do to make people cry out of happiness as opposed to making them cry out of unhappiness. Maybe I did that too much hard. I had to get away from that. But yeah, it was nice. That's why I decided to.
We have this concern about the superficiality of plastic surgery, but it's not. It's not. We can't transform people. We can transform souls. We can transform the mindset. Everything.
If done right, it's soul transforming. And I personally I had my nose done by my friend Richard Zumalin. It wasn't, it was just I trusted him and I loved the guy and he did a good job.
Yeah.
It's a little tip work. I've had some hair work done. I'm freely open about it, and I now see from the other side what how much it can do for your confidence, and you don't want to get too into your appearance where you're looking in the mirror too much. That's the other side of the coin. But if I can enhance someone's confidence and give them a better voice if they have something to say and they need the confidence to be in the media or whatever it is, then that's what we do.
The people improving in all of the areas after that.
All of life.
And work and relationships. Everything.
You become more attractive, more confident, more a lot of things. So
Right.
you become more successful. in a lot of areas of your life. Do you think that in US, as in Brazil, is being we see in Brazil that we have a transformation, like a mindset transformation now, that people is starting to look to plastic surgery more like this, like opportunity to transform people, to impulse people, to make them better, not just because of the beauty, and a little bit of mind changing now. It's starting a mind changing now. It's something a new paradigm. So do you think that in US it's are you living the same thing there, or still looking like it's
Superficial.
it's just beauty and very.
I think that one thing we both have in common in the two countries is that we both value the stealthness or the invisibility of results, where they're both elegant and undiscernible, but yet can be dramatic. And so the idea that it's transformational is definitely part of it in the United States. There still is that component of people that are the body dysmorphic disorder kind of faction of people. We have that, and we probably have that in equal measure here. But that is the best way to look at it. There's a book called Psycho-Cybernetics that you may or may not have heard of, that I actually heard of just from a friend after I finished my residency. It's by a plastic surgeon named Maxwell Maltz. I think it was from New York. And he wrote about the psychological transformation, where people literally become another person when you change something about their appearance. And the human situation is a very visual situation, and we take visual cues, and people will look at you differently if you look younger. People will listen to you more if you look younger. So that's what allows the soul transformation to come out, because it's about how you connect with other people.
Yes, because more than 60% of people are classified like visual people. So what is most important to make some impression in you is the vision. 20 to 30% are auditive, and just like 10% of people are all mixed together.
Men's are more visuals, huh? Men's are more
men
visuals.
are much more. Men are much more. But it's like 60% of people. So it's natural for us that of course you get more attracted for what you see, and that's what I think that's one of the things that make people want to look better and to make surgeries and everything. But one of my concerns about because I really like face rejuvenation, I really like facelifts and face surgery, but as the same of the cardiac surgeon in the beginning, I want to be a cardiac surgeon, and I was thinking the beginning of my college. I think that's going to end because hemodynamics is going to take all the place.
All the place.
And then I said, no, I'm not going to do that because
hemodynamics, no. For me, no, for me.
Yeah, and then I think that now it's of course, just like you said, it's not going to ruin the facelifts, but with all this procedure, I've been seeing that people are like postponing a little bit more the facelifts. Do you see it like that?
That's not the way I necessarily see it.
Which is the average age of your patients?
Well, my average face, I just did a study on this, and my average facelift age is in the low 50s.
Low 50s?
Where I am in Los Angeles, it's really actually rare to get someone who's in their upper 50s who's not already had a facelift.
It's
kind of like if you're in a pond, if you're a fish in a pond where it's a catch and throw back, it's rare to find a fish that hasn't been caught yet. So Los Angeles is like the fishes that have been caught. So every now and then you catch a virginal fish, and it's a pleasure to do a facelift on someone that's never had one. But I do also the endoscopic Scarless facelift. It's something that I've developed, and that's what I'm presenting on Sunday here, which is an honor to do, to educate people and trying to get other surgeons to try to do that. That is done on younger patients.
Because here in Brazil, there are, I think, few plastic surgeons going to the facial surgeries. What do you think about Marshall?
I think that's I think
that a little bit here. With when we compare with breast surgeons, body surgeons, I think here in Brazil we have a little number of plastic surgeons going to this area.
But I think there is a new movement now.
Yeah.
I've been seeing more plastic surgeons going to go to the face again because of the market, You
Yeah.
see them. Oh, nobody's doing that. I want to do, you see?
Nobody here in Brazil.
Yeah.
Nobody. Just a few number of
Yeah.
plastic
are
surgeons
doing facelifts.
doing just facelifts.
Only face.
Only
Only
face.
face.
Yeah.
Right.
Only face.
Well, that's an interesting contrast. In the U.S., we have more and more probably doing only facial surgery. Now, I'm trained like you all in body and facial surgery.
but I think it's a new trend now. It's a
Yeah,
new
where
trend.
more
Yeah,
people
it's
are
not
Here
a
in
new
Brazil.
thing, but
Yeah.
But
Yeah.
as you were saying, in the US, you have more.
In the U.S., we have, in general, it was always the board certified or body and face trained plastic surgeons that were sort of leading the way in facial and body surgery. Now, the facial plastic surgeons, which are otolaryngologists and head and neck surgeons, do a lot more than they used to, and they're, I've been invited to lecture in front of them more than I have to the body surgeons and the combined general plastic surgeons. And I think their knowledge of anatomy is different. It's not necessarily more accurate, but it's they have a different approach, and so it's kind of a joy to communicate with both of those two groups.
You think it? I always look like for the like competitors, like it's not against me. We are all improving together.
Yeah.
I like to look the market like this, because otherwise you are going to fight everybody, and it's not good for the
It's
patient.
not good for the
you
patient.
see?
It's not good for your blood pressure.
Yeah. So of course, sometimes you have to you have to put more energy. See, more effort, but it's okay. I think it makes us better for the patients. But sometimes it's a challenge, right?
It's a challenge, but that's what meetings like this are all about: is collegiality and sharing ideas, being honest about complications and what could I do different next time. I think that's, if there's one thing I like to share, it's that every result I get, I try to get better and better, but I'm never going to be complacent, and I'm always going to be critical of my own work, because that's what the patients benefit from.
Yes.
To be humble in the face of something that you can't necessarily choose how someone's going to heal. Even if you've executed an operation perfectly, the healing process can say otherwise. Sorry, you screwed it up. I thought I didn't, but
Do you have any like I don't perform a facelift if the patient has this or this, or do you have any,
yeah,
Smokers or something like that?
Smokers are, luckily where I am, literally almost a non-issue. The only people that I've had that come in that are heavy smokers are well-known Hollywood actors. A lot of times smoke 2 packs a day. And you can still do them. The type of facelift I do,
because you do a minimally invasive technique, huh?
Yes, or just deep plane in general, which is the open technique where there's an incision in front of the ear is safer to do on smokers. I don't have a significant or really a very minimal negligible rate of wound healing complications that are significant. Now, I don't do a lot of smokers, and nor do I want to, but I would be comfortable doing it on a smoker if they were to come in. And then the best answer to your question, though, who would I say no to? The number one person is someone who has a lot of filler and they like it. I don't even want them in my waiting room. And I said this on a show called TMZ in the U.S., which is like a sort of a gossip celebrity show once. They cornered me at a premiere with a girlfriend I had who was an actress. And they asked me, what would you do for this? It was like this woman named Octomom that had 8 kids on TV. She had lips that were like the size of 8 lips. And they said, what would you do for her? And I said, I don't want her in my waiting room, because then every other patient thinks that I did those lips, even though she's trying to. So those are people that I try to deter them from even coming in before I have to say no to them.
And just to clarify for everybody that is watching us, of course, that's very important, because everybody looks to everybody, and you don't want them in the waiting room, because what you just said. But you were talking about the deep facelift, and the deep facelift for everybody is when you go more profound, more deeper, and correct me if I'm wrong. When you do a deep facelift, you don't have to put so many tension on the skin. That's why is that why you become more comfortable to perform a facelift on a smoker, or
yes
because
and no.
You do a fast surgery.
No, it's not. In my hands, I say it's not how long it takes; it's how long it lasts and how good it looks. I take my time in surgery.
I think it's the same way.
Yeah, I mean, I'm dealing with some movie stars, and the paparazzi will see their ear, the incision on their ear. And also I always tell patients, and when I lecture, I tell people that people don't see their tragus, which is the little nubbin of cartilage in front of your ear. You've never seen your own other than in a mirror. It's hard to take a selfie of it because it's hard to focus.
Yeah.
But your friends and your frenemies, as we call them,
Frenemies.
they see that scar and they'll start talking about it, and you have no idea. So I think that's an important thing to take your time on, and that's why I developed that Scarless technique also. So those are.
How are you guys? Sorry about the
Pablo.
delay. What I forgot here.
A lot of things now.
We're done.
Maybe we.
We're done.
Maybe
Thank
we
you,
can,
Dr. Manny. Very good.
Start again.
Start over.
Do you have any questions?
What was the first question?
But the smoker doesn't bother you
The smoker
because
doesn't bother
you think it's safe to do
I wouldn't necessarily say it's safe. I would always warn them in advance and try to get them to quit as much in advance, for the healing period. So I do think that's important. Just honestly, it's not something I have a lot of recent experience with. I remember as a resident, but yeah, but doing a deep plane operation. Well, the answer to your question is it's partly that you're not putting tension on the skin, but mostly it's because you have a more robust blood supply. Because smoking impairs microcirculation, as we all know. And so the microcirculation is more robust, even in a smoker, when you have a thicker flap. You have that layer of muscle under the flap. There's just more blood vessels, albeit smoky blood vessels, but they're there. There's more of
But there are.
There's still more.
If you save them, they will save the skin, right?
Right. Yeah.
And tell us a little bit more about your technique, your
Yes.
endoscopic facelift.
Yes. So the deep plane technique in general is I describe it like a sandwich, where you're lifting up the whole sandwich. And one of the things that I wrote this article that was fairly influential over younger surgeons, which was an anatomic rationale specifically for doing a deep plane technique as opposed to a 2-layer technique. There's a lot of different types of facelifts, but in essence, a deep plane lift keeps the deep muscle layer of the skin of the face attached to the skin, and gravity drags down that muscle layer in a sort of a glide plane. We call it. It's a path of least resistance. So the most natural way, and it turns out the safest and elegant way to rejuvenate a face is to lift that muscle layer up and keep the skin attached to it. The consequence of that is that the skin moves as it's supposed to move, which is in accordance with the way the facial muscles move. So the facial expression is more natural, unlike with fillers, for example, which divorce the facial skin from the facial muscles. So that's one of the key things about it. Now, the scarless one, because of my philosophy of plastic surgery being a form of deception and the frenemies seeing the incision, I said, some of these younger patients, I don't want to put a scar on them.
Yeah.
And younger patients don't heal as well because the skin is thicker, the dermis is thicker.
It's the same principle of Mila or Mila now.
I think maybe Myla.
What's that?
The minimally invasive lipoabdominoplasty. Here in
yes.
Brazil, we call it
Mila.
But
right? You were
USA,
telling me about that.
Mila or no?
Yeah. I don't think it's made it to the U.S.
Yeah.
The name anyway, but maybe it has. I do body surgery, but not a lot.
Yeah, because we think about just the same. We don't have to put a scar on a young patient.
Yeah.
With low or moderate laxity on the skin.
You do it endoscopically.
Yeah. We do all endoscopically.
That's
so it's
beautiful.
the same principle.
Yeah, I love that. Yeah.
And where you, Dr. Mark Manny, where you put the scar
Yeah.
in brow lift, endoscopic brow lift?
In an endobrow, as we call it, I do 2 paramedian incisions, which are about 3.5 centimeters away from the midline. Usually, they're about 1.5 centimeters long. The typical. And then I do usually one just right here below this temporal fusion line. So it ends up about being right here within the hair for an endoscopic brow lift. Then for the scarless facelift, there are incisions within the hair also. So that's why I can truly call it scarless, as long as it's covered. On a bald person, you couldn't do it, obviously. But on people with hair,
it's a hidden
right
scar.
Here. It's a hidden scar, yes. And then it goes here and then behind the ear. So that one's within the hairline. There is an incision within the sulcus, the crease behind the ear, but that's no one literally is going to see that. And even when you fold your ear forward, you have to look hard to really be able to tell. So
I don't know if you have already made this question. What type of material, stitches or a special material to
Stapler.
Yeah, though I threw away the stapler a while ago. I had used a staple. Well, staples do make sense in the hair.
Yeah.
Because they don't completely close the blood vessels off. So the theory is
Oh,
that
nice.
they don't cause as much
Right.
hair loss. However, I had a patient who was an actress from mainland China, and she got on the plane. I let her go early. It was my mistake. I did a face and brow on her. I let her go on day 8, and she bled a little bit on the plane. And that was not a pretty situation. Bleeding a little on the plane. What do we do? I don't think they made an emergency landing in Alaska or anything, thank God, or wherever it would have been, Hawaii. But she did fine. But then I was like, one of my mottos in surgery is, if you make a mistake, make it once. Don't repeat your mistake.
Yeah.
Be aware enough of what you're doing to correct your course.
Learn from your mistakes.
Yeah. So I use very fine 5/0 nylon or 5/0 Prolene right just next to the skin edge on all those incisions. It works better.
Oh, nice. Which areas you can improve? Brown lift and the zyggomatic
Middle third.
middle third.
Okay, so this is a funny question that you asked. What you're asking, what I can improve endoscopically, right?
Yeah,
Yes, endoscopically.
Yeah, endoscopically.
Yes.
It's funny that you asked, because as you may know, there's a text thread that the great Mike Nyack started on Telegram. It's a text thread between other surgeons, and there's another surgeon from Morocco who's a brilliant guy who came out with this whole diatribe about how an endoscopic lift can't correct the lower face.
Cannot.
Cannot.
But he's wrong. It can. And so I got into a little tete-a-tete with them about that.
It
Like,
really can improve
can.
this part.
Well,
lower-
so let's just explain how that happens. The lower part, so the first thing I do with the Scarless Lift is I do the postauricular incision, and I address the neck and the lower face under direct vision, but without cutting in front of the ear. So that's done sort of non-endoscopically, but with the knowledge that I am then going to come up here and do an endoscopic dissection of this whole part. And then I connect the two with the endoscope. I connect, the SMAS cup. So it's basically a deep plane facelift, the same exact operation, just without a scar here. And,
Perfect.
Yeah, and so it's something that I started doing about 7 years ago. There's a surgeon named Chachi Keo in the LA area, Santa Monica, who started doing it first. I was lecturing right before him in Vienna a couple of years ago, and they let me lecture first. And so I figured if I was in his shoes, I'd be a little pissed off that the guy who started doing it second was going first. I wasn't complaining, but I took him aside. I said, Chachi, I'm gonna give you credit for that you've been doing this for 20 years, and I started 7 years ago. And he goes, 21. So that was my joke that I started out my lecture. I said, I went up to Chachi. But my technique is very different from his. There's certain nuances of anatomy that are different. Our aesthetic goals are often different, and so we don't really compete for the same patients. And I love Chachi. I have a lot of respect for him, like a lot of the other surgeons. We really get along. I think at a certain level where you're just trying to improve, we end up sharing information and like, what should I have done? And so it's a great thing. And it's, again, like you say, it's for the benefit of the patients.
And does he do the deep plane too, or his technique's not deep plane?
It is. It's deep plane. Honestly, I haven't really, I asked him jokingly, how do you do it? But I would never really go to his audience. That's a little bit of a boundary where I wouldn't even ask. I want to figure it out on my own. But from what I've seen, it is, to be technical, he goes under the frontal branch and approaches this part of the face subperiosteally from here, and then goes supraperiosteally here. And there's other surgeons. In fact, there's a surgeon, Dr. Kul, who's here from Turkey, from Istanbul, who does the same thing. And he does it brilliantly. My philosophy is that I come sort of a little more laterally, and I go over the frontal branch as opposed to under the frontal branch, which is a nerve branch that goes from here to here. So I go over it, and that way I'm able to duplicate essentially the same deep plane operation without a scar, and get the same sort of big sheet of sandwich flap to elevate.
Dr. Mark Manny, can you come closer to the microphone,
Yes.
please? I'm a little bit deaf.
Yeah,
Sorry.
Not loud enough.
First guy that I in my life that I heard talking about deep plane was Brian Mandelson from Australia.
Yes.
I was not even at the plastic surgery training yet, and I was like, I was thinking, that's fantastic, because Brian, the technique, of course, very nice, and he had this PowerPoint that was fantastic. It was keynote because he was huge. It's a Mac, so I was, oh my God, that's completely different, very nice. And since then, I've seen that more and more plastic surgeons that goes to the facelift, they are doing deep plane, deep neck, and deep plane facelifts. Do you think that's true in US too, or it's just more like I think?
Yeah, I
some,
mean,
some
it's
plastic surgeons or
yeah, it's definitely true, and I like to think I've been a part of that because I really thought through it, and I never thought I would be, but I never thought that one article I wrote would be so influential. But it was based on sort of my ability to visualize the anatomy geometrically, and I also looked at I combined my experience, which is when I was separating too much skin here, as I was taught to do by the technique of Bruce Cannell, Tim Martin, where you separate all the skin. I realized that nothing was happening here. The midface wasn't holding up. So I looked at some anatomic studies. That was one from Germany and one from China, where they showed that the muscle layer really attenuates here. So you've got to keep it attached to the skin. And so that article influenced a lot of younger surgeons. And in the U.S., I do see that. And I think a lot of that is because of that academically, and also Andrew Giacono, Ventali in particular, a good friend of mine in LA, who's a wonderful guy, brilliant. But they have brought out the fact that they're doing a deep plane lift, and the public are smart. People have a good eye because, like we talked about, humans are visual, so they're able to discern that deep plane results are superior. And I'm very firm about that. There's no question about that. I don't mince words about that.
which is
doesn't matter if I agree with you.
Yeah.
Because it's the truth, right?
Well, there are arguments each way, and but I just think in general the facts bear it out. It's popular for that reason. It's not like we've really been pushing it, and in fact, it's sort of overcome one of the stigma of a facelift. The word, in the U.S. at least, maybe not here, but you can use the word face and you can use the word lift. If you say facelift to someone, you need a facelift, they just want to run out of the room. Yeah. I'm old, I don't want to. But when you start talking about deep plane, you can now use the word facelift a little bit more. I mean, we still kind of come up with these marketing terms, like I call it a TCF lift, which was really a stupid term, but that's the way it was a total composite flap. So I just used something that wasn't as gimmicky, but I do see the same thing in the US. Yeah.
And do you make some association to improve the
skin
quality?
You make the resurfacing.
Because Timothy does a lot, huh? Timothy Martin, he does a lot.
Fat transfer, you mean? Or?
Fat transfer and lasers and peelings and
resurfacing.
Yeah, I mean laser peel. I mean, I think he's done a lot of fat transfer and nanofat. And the way this all happened was that when we were doing fat transfer, I think as early as the 80s or early 90s, we noticed that just with fat transfer, the skin would start looking better. Yeah. And so, Sidney Coleman in New York, who really was a brilliant, innovator of facial fat transfer, took it to the next level. And then it was really Tonard and Verpali in Belgium who started doing nanofat. And I met Tonard recently in San Diego, and I didn't say this he wasn't there at my lecture, fortunately, but one of the mistakes that I think that they made is they call it nanofat, but there's no fat cells involved. So nanofat will not change the shape of your face. It's a skin treatment, and it's a more constructive skin treatment than lasers or peels, which I feel are destructive in the long run. Most of us in LA agree about this, that if you keep, abrading away your skin with those techniques, they have a short-term, addictive capacity because my skin looks so great. And then over time, it makes you pale as a ghost, takes away pigment. And so MIST, which is the acronym that I use for nanofat, is stem cells and other cells that support the skin. And
so regenerative.
Regenerative.
It's the same. There is I don't know if you
exactly.
Yeah.
Of course, you are very focused on face.
Yeah.
But there is a new trend in liposuction and liposculpting. We are now doing the filling the muscles with fat.
Yeah.
Really?
Inside the muscles, like the back,
to make them bigger?
Yeah, like in
but not too big.
Yeah, not too big.
It's
like in high definition.
Yeah. Then
high
you eat a
definition.
cheeseburger, you get more muscle. Can you do that on me? Because I love cheeseburgers.
No, it's fun. It's very good because you
can do a more natural.
Yeah, it's more natural. You improve the quality of the muscle and the size of the muscle, but it's regenerative too.
Yeah.
So it's fantastic because you don't have to mark the skin.
Yeah.
You see, you take off all the fat that you really want, and then
Yeah.
we inject inside the muscle,
Yeah.
and then you got the result that's much more natural.
So-
You see,
For,
you did
for
it-
high definition lipo, yeah.
Yeah.
so it's not like detached. You
Yeah.
see, like in the face, is not you don't
it's not-
detach.
it's-
It's
it's
natural because
it's
the
natural.
measurement.
Well, and I
Not
think it's,
not the fat packs in the belly,
Yeah.
just muscle packs.
Yeah.
yeah. So okay, so yeah, and so the advantage is probably going to age better because you don't have those issues of
Of skin marks.
the ab etching, and that may not age as well. So
Yeah.
does that mean that does it like, I guess because the first thing that a patient would ask is that fat going to turn into muscle?
Yeah.
Right?
Yeah.
And it does.
And
Well,
it does.
At the very least, I would think it would be regenerative for the muscle. So
Yeah.
that's brilliant. So
Yeah,
that's
it's
kinda-
fantastic. It's from a
Yeah.
guy that was with us here before today,
Okay.
and his name
He's the
is
one that
Mauricio
published
Viaro.
Yeah,
VR,
because we
okay.
saw in the muscle not just more volume, but hyperplasia of
In
the
the
muscle.
muscle.
Yeah, more
Yeah.
muscle cells.
It makes sense because when you work out at the gym, your muscle grows because of injury, the muscle injury, right, and hypertrophy.
We
And
talked.
so those stem cells in that fat are, as you know, going to respond to that injury.
Yeah,
That's what they respond.
And Mark, how do you prepare the fat for injections?
I prepare it in a very minimalist way. That's my philosophy of preparing fat. I like minimal time outside the body, and I
What
wait
do you use
until-
to like?
I use
what kind of
a
cannula?
tulip kit. When I'm basically for
Tulip-
facial work, I'm not really doing major liposuction unless I'm doing fat.
Yeah,
transfer to
just
the breast. But
for-
just
for
for
graft.
harvesting, I
Yeah.
use the tulip cannula system with
Two,
you know, and I-
2.0,
Coleman.
2.0,
which one?
2.0 or
The diameter.
2 millimeter. 2 millimeter.
Two
Yeah,
millimeters.
generally as narrow as I can get it. Yeah, and then I use an accelerator type cannula with the holes all facing the deep surface. You occasionally get little irregularities which you try to massage out with endermology and things like that. But I use a 2.0. I harvest
with syringe?
with a syringe. Yes,
Syringe,
I use a
syringe.
syringe. That way you have it ready. And then basically I gravity drain it and then inject it. And just over time with experience, you know how much to over inject. I don't like to over inject too much because patients go through menopause and their metabolism changes, and next thing you know they look like the Pillsbury Doughboy or something like that. So you've got to be careful about that.
So
Nice.
basic, do the basic
Yeah.
correctly, and you
Yeah.
got good results.
results.
Yeah.
Yeah, do consistent things. If it works, keep doing it that way. If you make adjustments,
I think that
along the way.
many times people
Because some people
want-
put antibiotics on the fat,
Antibiotics, a
insulin.
lot of
I saw
Insulin.
sometimes insulin
Yeah,
too.
yeah. I mean, I have, and also they supercharge it with PRP or PRF and
Yes.
things like that. I just don't want to. Part of it is I'm usually doing a facelift, which takes me a long time. Hours.
How many times?
8
hours?
Face and brow gets up to 8 hours.
8
Face,
hours,
brow, and eyes.
yeah.
Now we use very light anesthetic, but we do intubate. I prefer to have endotracheal intubation because I don't want my patients snoring with no tube.
Do you do in your
Yeah.
clinic or a hospital?
Neither in a private surgery center.
Right.
Partners in.
in US it's much more common.
Yeah,
like
yeah,
that,
yeah. Then here, yeah.
And it's particularly in Los Angeles, but in general in the U.S., most aesthetic surgery is done in private surgery
Yeah.
centers.
Because
not in
hospitals is too
hospitals.
much expensive. Yeah.
Hospitals don't want it because
Don't
they
want
get,
it,
they get
yeah.
paid better by insurance companies. So
And
it boils down
Too
to
much time in your OR.
it's fine with me.
It's
'cause
all
I'm-
about
I'm-
the-
I'm
He can
aller-
do 10 surgeries of general surgery in
Yeah,
time to
you-
do
exactly.
just one.
And
Yeah.
it's okay with me because I'm allergic to hospitals anyway. I roam the halls until 5 in the morning, too many days in my residency.
So, Dr. Mark, in your opinion, what's the best way to improve the nasolabial fold? Because in
It's
my
a private
opinion,
consultant for you.
yes, please,
He's the patient.
because it's the most difficult part to improve in the face.
Yeah,
in
so
my
so
opinion.
surgically, it can be improved. You just have to know the anatomy enough to undermine, the subsmass plane all the way to the nasolabial fold. There's if you get into the anatomic nuances, I think you need to go under the orbicularis oculi muscle. I think that helps because you have a more robust, durable flap. There are people that disagree with that. I know Andrew Giacono does what's called a deep plane operation in the purest sense, which is over the eye muscle, over the orbicularis oculi muscle. I think it should be done underneath, and I think that also helps to secure the nasolabial fold. But that's the best way is with a properly done deep plane or composite flap facelift. Now, in a younger patient, you can do fat transfer, you can do filler. But again, I find that filler, the way filler works is it just creates a dam here that blocks lymphatic channels, and it gets full right here. Yeah, it's going.
My wife
limits.
doesn't like it.
Yeah,
And then there is a thing. There is a thing that is very, very nice to see, because the dermatologists, they started to study a lot of anatomy, much more than we can
we can imagine.
They study a lot.
They are studying a lot and a lot and a lot.
We operate, they study.
They don't do like the fillers the way they used to do, like just to so it's I'm going to put some here, some put to just to eliminate the shadows, but now they are trying to give this this application like to sustain something, to improve the ligament, to sustain, not just to feel something,
right.
So I think it's becoming more natural. The results are better because they are trying to do something that's natural, that that's
where so less is more.
They are using more like a Sculptra than fillers today, I think.
Yeah, but even with the fillers, even with the fillers, they are doing like 3 points just to sustain here the zygomatic.
So that makes sense. I mean, that's something I honestly had not thought about that. Please don't tell the dermatologist in the United States.
Don't tell to your wife.
Take business away from
but I think that's very good, because it's just that the way you said, you have to understand the function. You have to understand the anatomy, how everything functions. So they are really starting to become very good in that. There is a guy. Have you ever heard about Cotofana, Dr. Cotofana?
No.
He
Me
became
neither.
no.
Me
He
neither.
became a anatomiologist.
Yeah.
He just works.
Study an
Anatomist.
Anatomist. Yeah.
Yeah. He just do that. He studies anatomy and teaches anatomy to everybody. He doesn't perform surgeries, nothing else. And he's one of the most famous guys in the world now, because he's teaching people about anatomy, very, very tiny details.
Who's the most famous guy?
Cotofana.
Yeah.
He's where is he?
He's from Colombia. Maybe I'm not sure. I'm not sure, because the dermatologists, they know.
And my wife knows.
And it's incredible what he's doing, because he's changing everything. The way that they are perform the procedures now are changing a lot, and I've seen a lot of improvement, at the results. And less fillers,
more
using on the right way, and more skin quality. You see, so I think we're trying. I think I see a movement that to improve the results, but not just that, to make people look more natural. Like even the Kardashians that we are joking about.
Yeah.
We are joking about them because, of course, everybody talks about them, and even Kim Kardashian took off a lot of their fillers.
Yeah.
Did you see?
Yeah.
She took a lot. She took off a lot of the fillers, because it's not more. People doesn't like anymore that just overfill it. Everything.
Yeah, you don't look younger. Your face looks bigger, but not necessarily lifted. Just bigger.
Yeah. Just bigger, not lifted.
Yeah, there are people in LA and Beverly Hills that do beautiful filler, and that I send patients to if they have no fat. I'm happy for them to do it. But yeah, usually it's minimalist, and you're right, very strategically placed.
Yes.
Which is the amount of fat you put on a face, average?
I'm not a big like 80 cc's fat transfer person. I usually break it down by area. So if I'm doing temples, it's a little more like, but still 5 cc's at the most per temple. And then in the cheeks, it would range. If someone has super flat cheeks, I could put up to 5 there, but it would just all depend. So it's all, it's like art. You want to, figure out how much paint did he use for that painting. That's sort of less relevant than where.
You don't need a bigger area from Harvard for harvest.
What do you use to harvest?
The harvesting, I find that, like I was saying, there are a lot of patients in LA that are a little anorexic, sometimes. They're like triathletes, and you look at them and you're not going to have enough fat. Although I will say, I just operated on someone. It's the second time I've been able to not get any fat from them. And the other time was someone that was on a protease inhibitor or something like that. They have no fat. This patient also had no fat, and I think it turned out afterwards, I found out she was trying to walk on a treadmill for 4 hours a week after her facelift, and she's kind of a friend of mine, so I kind of had to shouldn't be doing that. But
in this case, do you use a filler or no?
No, I would, and I'm always kind of happy to send a patient to someone else for filler, because the filler people send me so many surgeries that I can only have to reciprocate. They know I don't like filler, so it's gonna get a trap. But
you don't have a fat bank like blood.
It would be nice. It would be nice. But to answer your question, the best I find harvest area is the flanks.
The underside
That's
flanks?
the most common on the sides, and inner thighs is
And the
sometimes
knee?
second.
The knee?
Knee's
The
okay.
inner knee.
Knee's
In
okay,
girls
but
without too much
these women
fat.
in LA, they're not going to have too much fat on their
Yeah.
knees. They don't know. They think they do. They're like, oh, I have a lot of fat. Where?
Yeah, it's the same here in Brazil.
Yeah. Body conscious. Yeah, that's right.
Yeah.
They take good care of themselves, which is a
Yeah,
great thing.
But the body type in the US, they have long legs and not too many fat.
Long-
on the-
long-
On the hips.
They have
not
long
too many
legs, small butts, and small breasts, because we've been doing breast implants for so long that we've bred out naturally large breasts. We've
Yeah.
evolved to have no women because the women with big breast implants have been so successful reproducing that their daughters don't have It's just a beanpole.
Maybe.
Yeah.
Very nice. Yeah, I think that's the same movement with boobs in Brazil. The same of the fillers. People used to like big boobs or bigger implants,
Not
and
too
now
much
and
now.
now, and now it's not like we used to put like 400, 450, and now
Yeah.
we have
In the past, yeah.
and now we have
Reduce
better
the
results,
sizes.
much better results with like 230, 280. You see?
Yeah, well, and also as when I started my practice 21 years ago, good God, I joined a very famous revision breast surgeon named Neil Handel, who's still one of my best friends, and he always told me, larger implants have a higher complication rate, and I think we all know that to be true. It squeezes out your normal tissue. And so, yeah, it's the same in the U.S. And people talk about it all the time. Oh, everyone's going smaller, but now that really, really is happening. People are getting rid of their implants and doing fat transfer instead.
Yeah.
A lot.
So it's the same in US. It's
The
not
same,
just
but it's kind of a
Brazil.
catch-22, because almost by definition, a woman with really small breasts that needs fat transfer is not going to have enough fat, because fat to the breast doesn't survive as well, as we all know. But it works well as long as their expectations are reasonable.
Yeah, sure. I think that's what the most important, because when the expectation is right, the frustration is low.
Yes, actually, that's well put. Now say that in Portuguese. And I'll use
Em português quando a expectativa é correta, a frustração é baixa, low is baixa. And I think that's the secret to have a happy life like plastic surgery.
Yes. Minimize
This is the
expectations.
meaning of happiness.
Yeah.
Under promise and over deliver.
Yes, under
Yeah.
promise and over delivery. Yeah.
Very nice. I'm going to use that. in
I'll put this on.
And I don't have it
I
trademarked.
put this on my wall in the
Yeah,
reception
that's
area.
With a picture of.
Subtle message.
I learned it from Doctor.
Yeah, with the picture of me.
Very nice, very nice. So when I don't know if the beginning did you started with the deep plane facelift since the beginning, or did you change it?
No. I started. I knew when I came out of residency I was going to do SMAS, a separation of some sort, SMAS release. But deep plane was not really a thing that was done very very often back then. And so I started out doing bilamellar, 2 layers, and did it was Jim Stuzen in Miami, Tim Martin, and Tim goes farther, and I credit Tim with part of the reason I became a facelift surgeon, and I told him that about 6 months ago. I finally got the chance to see him and tell him that. I've talked to him before, but I realized I need to. He's brilliant and such a great teacher, and so many great articles. But my article was sort of about a switch away from that technique. And, he asked me to co-teach a teaching course with him in 2008. I'd just given my first big presentation at ASAPS. But I realized I'm going to start doing deep plane at that point. And so my paper was a specific comparison of 100 cases before and 100 cases after, and how much of a difference did it make? And it made a difference. It was double the elevation percentage-wise in the mid-face. So, yeah, so I made a conscious switch, and I think it was based on the anatomic studies to do deep plane.
Fantastic. And it's so nice to see that, of course, you used to give your best, and you still give your best, but the technique changed the results.
Yeah,
and
the
now you
technique
see
is... yeah, I mean, I think you see a lot of surgeons when they get older, they don't want to spend the time, and it's a long surgery, your back starts to hurt, and they abandon these techniques. But I know for a fact I will never do that. I will, if I'm hobbled by back injuries, I'll just quit. I'm not going to do a cheesy, shortcut.
Yeah, when we start to do the fast recovery breast augmentation, people say, do you still do the other one that's cheaper? And I say to them, how can I give you something that I know that's not my best?
Right.
You see, it's the same with you.
Yeah,
how can you not do something that you know
well,
for sure
we're
that's
perfectionists, and in general surgery they say the enemy of good is perfect. Get out of the operating room. In plastic surgery, the enemy of perfect is good. You don't want to settle for less. That's kind of the thing that I always tell patients.
And which is the best advice that you can give to the young surgeon that is beginning in the deep plane facelift surgery?
That's a very good question.
To avoid the complications.
Yeah, so don't be bold. Learn as much as you can. Watch other people operate, and if you're in training, secure as many chances as you can to get to do that with people that know what they're doing, watching you. When I was in my training, they liked me and they trusted me once they get to know your skill level. So I was able to do a lot of facelifts of half the face of a private attending's patient. And then by the time I was at the Veterans Hospital, I did several facelifts there. One of the patients referred me like 10 of his female friends. And so I had my own aesthetic clinic as a resident. And so I would just start doing them, and I would choose the one professor who wouldn't show up so I could do it all on my own. So not many people are lucky to have that opportunity, but I always tell them just go a millimeter at a time in the deep plane and make sure you're not injuring. If you don't know what it is, don't cut it. You just be very careful and methodical, and I try to show that in technical videos. You sort of proceed bluntly, and you got to know what you're looking at. And so just go a little bit at a time. Don't be bold. Then once you get more confidence, like, okay, I did that, the nerves are fine, then you keep going, but very slowly.
Be patient to make it right.
Yes. Yeah.
Because it's better to do another facelift than have a complication.
It's better to do less than more. And I say the same thing about when someone comes in already having had a facelift. There's certain surgeons that I'm happy to do their second one because I know they've done it right, and I'd rather have a surgeon, if they screw up, I'd rather they do less than more, because you can't fix it. If they've taken out too much skin or messed up the vectors of the face, it's hard or impossible to fix that.
I always, when some people that had surgery on another doctor come to me, I always ask, who did your surgery? And I explain to them.
To talk about it.
Yeah, they don't. Sometimes they don't like it because they think that's not ethical. And I just say to them, it's not because I just want to know who is the guy, because sometimes I know how he does the surgery. I know the technique, so I know what I can expect from your surgery.
From my technique with you.
Then I say, okay, it was this guy. Because before that, I can't remember. I don't remember.
You know what I always say? It was 10 years ago. I hope you remember my name in 10 years.
Yeah, I say the same.
I'm going to agree. You say the same.
I say the same. Very nice. I say exactly the same. So you are going to forget me in 10 years, huh?
Or in 2 years, I don't know.
Yeah, but I do the same thing with the surgeon. I'm hesitant to ask, but then I realize that tells you more than an operative note will, or maybe sometimes tells you more because you know their techniques after a while.
Nice, very nice.
In the breast, it's very common. You need to know about the other technique in breast because the flaps.
Much safer. It's much safer. Yeah, much safer. But not every time they tell us. Well, that's okay.
Maybe they didn't actually forget. They just don't want to say.
Any questions, guys?
I have one last question. Did you see the Maverick movie? Tom Cruise.
I didn't, but I know a little bit about it.
Tom Cruise. What's the secret? He's
aging?
What's the secret of Tom Cruise?
What's the secret of Tom Cruise?
With his face?
He's so young. Yeah. He looks so young.
Honestly, I disagree with you. Not in a bad way, though. I love Tom Cruise. He's a great actor, and I know a lot of these actors, And the last thing they want is for their face to be to look artificial, because they're into authenticity. Acting is about being authentic, and so anything that's noticeable, that, like I always say, the human brain has an entire part of a lobe evolved to recognize faces. It's evolved before language did, and so the actors don't want to have anything that looks noticeably artificial. Tom Cruise, I think he has aged actually in the recent times. I don't think he cares, and I don't blame him. I think his face is more tautic. He hasn't really, to me, done anything with his eyelids, and more power to him. He's just a very interesting guy, and he walks the walk. There are other actors that, you ask what's their secret. I know because I did their facelift.
Yeah.
I don't tell anyone.
That's my question.
And then I'll see them on a talk show and, it's a glass of wine or younger spouse or something like that.
I think it's the same in Brazil. Huh?
Yeah. Well, people ask, like, doesn't it make you mad? Shouldn't they? But that's the whole point, is for them not to have to say anything. It can't be obvious. And that's something that we have to take pride in, is doing the type of work that doesn't announce itself like that, where they can do that. So we take deep pride in that. And I really take pains to protect, confidentiality is implicit, and it's the law. And, with patients like that, it's a lot of work. I end up going to their house to remove stitches. There's certain places where I draw the line. You don't bend any rules as far as medical clearance or ethics or pain medication. But I will make exceptions, go to the house to remove stitches, and it's a high maintenance thing. But it's been interesting, and I've gotten to know some people that are very well known, and as I'm sure you all have too and will. And it's an interesting world.
Yeah,
it's a challenge.
In US, they have a concern that's not very common in Brazil about the opioids. They have a lot of addicted in opioids because of oxycodone and of course.
Same.
But it's in US. In Brazil, we don't have it.
Yeah.
We don't have addiction.
No,
not in opioids. Not in
opioids. It's a lot.
Morphine.
Yeah, it's not the same. It's I find this very interesting because I don't know why, if it's because we have access to another drugs, or if I don't
easily.
Know. Yeah, I don't know. Or maybe cheaper,
Yeah.
I don't know.
Yeah.
But in Brazil, we don't have this kind of addiction. It's not a huge problem like in US. They have a lot of problems with that.
I think that my honest answer, it comes from a deeper problem, which is there's a sort of a spiritual crisis in the US, and it's a very materialistic culture. And so people are sort of looking for something, and this is a lot of disenchantment, dissatisfaction, and it combines with sort of the region. There's certain regions where opioids are much more popular. Where I am, they're not. Where I am, there's people are happier. There's surfing and other things to do, enjoy life, yoga, whatever. And so people don't really, but in the Midwest, the weather kind of sucks. And so, like, where's my Vicodin pill? Like, I can't really blame them, but not really. No, it is a
like
problem.
In Canada.
It's a problem. Like in Canada, you would see, but that's Canada. They're a little more low key, and I don't think they have as much of a problem as we do in the U.S. But it's a kind of a cultural thing. We've got problems, solvable problems, and I love the country. But yeah, that's a big problem.
In Brazil we have a lot of different kind of addictions with drugs, but not with Vicodin and opioids.
Yeah.
It's different, but I think because in the fast track recovery from John Tabbitt, John Tabbitt, it's clear. It's very clear for me. It's opioid free. He's
opioid free technique.
Opioid free technique, because it's very important to them
even
to be free opioid. You see, but in Brazil we could use opioid if you wanted to, because we don't have this problem,
Right.
So we learned from him. We don't use it,
Yeah.
but we could use it.
You could if you wanted to.
Yeah. So it's alright if something's off. Like 95% of the patients are going to have the fast recovery. 5% are not going to have it because they have pain. So it's okay if I give them a little bit more of painkillers and opioid.
No problem.
You see, if I need to.
Well, in my area, we keep them pretty comfortable. I mean, I know that there are women that have had their breast augmentation and got addicted to Vicodin. We don't give it out as much anymore, but we can, and we want to keep the patients comfortable. So
But in facelift, you don't have too much pain.
Facelifts usually aren't that painful. I've never had one, so I don't really know. But most of the time, I've done a lot of them. So patients say they're generally not too painful. There's ear pain sometimes, and claustrophobia from the dressing, which just stays on a day or two. But yeah, pain is not usually the main thing.
Yeah, that's very
because
good.
you're not cutting through any big muscles or big fascia. I guess that's why.
Yeah, it's very good. But sometimes they say to you, I'm feeling like this. No?
Yes.
They say,
Sort of like that.
Yeah.
Or like, I'm too tight here.
Yeah.
How long is this going to last? And the patients always want to know, how long is the swelling going to last? And
Yes.
I've
They always
been doing this for 21 years, and I still don't know the answer for that. I don't know. It depends. It depends on your body. It depends on the healing process. So people need to understand there's a lot of variability with those.
Dr. Mark, the last question is now, Pablo. Do you have a team to do your post-op treatments, or you do by yourself the post-op?
Sort of in between. I have a boutique style practice. I spend a lot of time with it, and especially dissolving all the filler. I get to know the patients pretty well now because we incorporate it into the fee, and my fees are higher. I tell patients they should be prepared to choose between purchasing a loaded luxury automobile or having a facelift. That's you get to a point where that's your practice, that's your patient population, but you have to back it up with results that are as exquisite as you can possibly get. And I spend a lot of time with the patients and really get to know them. And a facelift, particularly for women, is a very emotional decision to have a facelift. So having the opportunity to dissolve their filler in advance, I get to know them over multiple visits. But I do have a nurse that takes the stitches. I have a tech and a nurse, and they together take the stitches out. I have other things that I'm working on. I write a lot, and I'm have other interests, so I get to do those between patients. But I do go in and say hi to the patient. It's just nice to have someone else to take the stitches out, and I always tell them that I'm good at putting them in, they're good at taking them out. So they feel comfortable. They're very good.
It's very nice. It's very nice. And how many patients do you treat on a month?
Well, it's
Which
the
is your
average
routine?
week. Like when I do a facelift, I only do one a day. I only do one a day.
One
So
a
I do
day.
one, and it's
One a
every
day, it's
other
enough.
day. So one every day.
You
would
work
exhaust-
Monday
yeah,
to
Monday,
Friday?
Monday, Wednesday, Friday.
Monday,
A
Wednesday.
lot
times a
of
week.
Fridays
3 times
are a lot of Fridays are local procedures where I do the MISC, stem cell injections, or fat transfer in the office, just on an exam table in the office. And then on my patient post-op and consult days, I see between 12 and 17 patients. 17
And
would be
in
busy.
your practice, the patients don't want to do associate procedures. Like, I want to do a facelift and a breast lift. Because here sometimes aparece.
They want to
they want
make-
to do all the things in the same.
Yeah, they
But
do.
I
They
don't do it.
Total
But
body lift.
not at the same time. I mean, I will do it on a Monday, Wednesday, though. If I have one patient, that's my favorite week, is the same patient, because I know the patient. I know they're going to do beautifully. We get a full medical clearance, obviously, but we'll do, full day Monday and a full day Wednesday, and they do really well.
Yeah.
Maybe it's also just using sedation with propofol. Recoveries very easily. I have an outstanding anesthesiologist, and he's a good friend of mine. He's very attentive. And so they do fine. But yeah, I do that. And most of the I tell people all the time, most of the non-facelift work I do is on facelift patients who want that, or their daughter's nose, or their mother's,
Nice.
whatever it is.
Nice, very nice.
Okay.
That's
Okay.
all, guys.
Our question, no, all right.
Dr. Manny, we'd like to thank you.
It was a pleasure
Again.
to have you here.
Thank you.
Very
Thank
nice.
you so
Great.
much.
It's
Thank
it's
you.
a pleasure to have. It's an honor to have
To share your knowledge with us.
so fantastic and
Yeah.
very well success doctor here with us, and it's an honor. Thank you for your time,
Thank you.
for your attention, your patience.
Thank you. It's
Okay.
a pleasure, and it's an honor for me, and I'm very impressed. You guys are just a great society you have going here. I'm impressed by the quality of the work and the presentations. It definitely would give a run for the money of anything I've seen in the U.S. So
Thank you.
Thank you.
Thank you
Right.
so
Thank you.
much.
Thank
Thank
for the
you.
compliment.
Hope to have you more times with us.
I hope so too.
Yeah.
Thank you,
When I
Mark.
wear out my welcome.
Thank you.
Thank you, Mark.
guys.
Thank you.
Bye-bye.